Welcome back to our Health Pointers. Today, we're diving into a topic that affects many lives: leukemia. Leukemia is a complex and serious condition that requires our attention. So, let's get started with an exploration of this disease, from its definition to prevention strategies. So let's begin. Visuals of leukemia cells and medical illustrations. First, what is leukemia? Leukemia is a type of cancer that affects the blood and bone marrow. It occurs when abnormal white blood cells are produced in large numbers, crowding out healthy blood cells and impairing their normal functions. This disruption can lead to a range of symptoms and complications. Or, a type of cancer which affects the production and function of blood cells. This causes swollen lymph nodes, recurrent nosebleeds, tiredness, frequent infections, weight loss, bleeding, and bone pain. History of leukemia. Now, let's take a trip back in time and explore the history of leukemia. The first documented case of leukemia was described in the early 19th century. Since then, significant advancements have been made in understanding its pathophysiology and developing treatment options. From early chemotherapy to targeted therapies, scientific progress has paved the way for improved outcomes for leukemia patients. Pathophysiology of leukemia. To understand leukemia better, let's explore its pathophysiology. Leukemia develops when genetic mutations occur in the DNA of blood-forming cells. These mutations disrupt the normal growth and maturation processes, leading to the overproduction of immature and abnormal white blood cells. As these cancerous cells multiply, they accumulate and interfere with the body's ability to fight infections. Antigen. Causes and risk factors. Now, what are the potential causes and risk factors for leukemia? While the exact cause of leukemia is often unknown, certain factors may increase the risk. Exposure to high levels of radiation, certain chemicals, and genetic predisposition can contribute to the development of leukemia. However, it's important to note that most cases of leukemia occur sporadically, without a clear identifiable cause. Complications. Leukemia can lead to various complications. Since the abnormal white blood cells crowd out healthy cells, the immune system becomes compromised, making individuals more susceptible to infections. Anemia, bleeding problems, and fatigue are common due to a decrease in red blood cells and platelets. Additionally, leukemia can affect organs like the liver, spleen, and lymph nodes, leading to enlargement and other complications. Lab reports and diagnostic tools. Diagnosing leukemia requires a thorough evaluation. Healthcare professionals rely on different diagnostic tools, including blood tests, bone marrow biopsies, and genetic testing. These tests help identify the type of leukemia, determine the extent of the disease, and guide treatment decisions. Regular monitoring through lab reports and imaging helps track the progress and response to treatment. Leukemia affects people of all ages, and its prevalence varies across populations. The epidemiology of leukemia shows that certain types, such as acute lymphoblastic leukemia, are more common in children, while other types, like chronic lymphocytic leukemia, primarily affect older adults. Understanding these patterns helps researchers focus on prevention and treatment strategies tailored to different populations. Preventive measures. Prevention plays a crucial role in reducing the risk of leukemia. While there's no guaranteed method to prevent leukemia entirely, adopting a healthy lifestyle, minimizing exposure to harmful chemicals and radiation, and avoiding known risk factors can help reduce the chances of developing the disease. It's essential to stay informed, follow recommended guidelines, and regularly consult with healthcare professionals. That wraps up our exploration of leukemia. We've covered its definition, history, pathophysiology, causes, complications, risk factors, diagnosis, lab reports, epidemiology, and prevention. Remember, knowledge is power, and by spreading awareness about leukemia, we can support those affected and contribute to ongoing research efforts. Thank you for watching. If you found this video informative, don't forget to like, share, and subscribe to our channel. Stay tuned for more educational content. Take care, and until next time.